Okay, I wanted to recap a few of the main points for this article: the structure of health insurance and the erosion of competition in the medical marketplace. Some of the findings are when insurance prices rise, insurance coverage has not been increasing. So if people's premiums are $2,000, their copay is $35, and their deductibles are $1,000, um, and let's say that they have to pay 20% and insurance covers 80% on a $50,000 procedure. When the price rises to $2,200, people will still purchase the insurance because they still want coverage for times when they have unexpected procedures, unexpected drug costs, or physician visits. When the price rises, they're still willing to pay that premium, and all other things will be equal. Their copay could be the same. Their coverage in every other respect is going to be the same. Insurance has not been keeping prices competitive in the marketplace. There are two main reasons that are discussed in this article. The first is technology. The other one is consumer search behavior, which really means that people are looking for quality. They're not really looking for competitive prices anymore because their copay is still $35 for a physician visit. Their drug plan is $10 copay, and procedures, they might have to pay 20%, but it might not be enough incentive for them to really price shop. They're just going to look for quality. Why the price increases? Like I mentioned, two main things: technology change and search behavior. Insurance and induced technological change. Technological change led to cost increases, and that's primarily in the product innovation. There are two main types of technological change. There's product innovation and process innovation. In product innovation, we have new products, new capabilities. In process innovation, we have techniques or processes that reduce costs of products. Now, under the category of product innovation, the examples could include a new MRI, new CT scan technology, new drugs that are patented. These things are more costly, but they give us new capabilities and new ways of diagnosing or treating diseases. Process innovation could be manufacturing drugs at a cheaper rate. It could be a way of ruling out diagnosis of a migraine headache through an MRI. What I mean by that is if someone comes in with a migraine, a doctor might find a criteria or a method of ruling out a headache, ruling out the need of an MRI in the case of a headache. And that would definitely reduce the $3,000 cost of an MRI. As level of insurance increases, product innovation increases. This technological change is added to costs. So of the two, of the product innovation and process innovation, the product innovation is really the thing that's been driving up costs. And really the system that we're in has incentives to use the best of everything, the latest drugs, the newest MRI machines, because once again, consumers are looking for highest quality of care over costs. Insurance and search behavior. Complete insurance. Consumers receive no benefit from searching out lower cost suppliers. Consumers may search for suppliers of better quality, but cost is not a factor. Now, if I get acne, I can go see a dermatologist. It might cost my insurance $300, but my copay is $35. But I'd rather go see a dermatologist who's a specialist over a family practice doctor who might cost $80. That might make more sense in the case of somebody who has cardiac problems with diabetes and they're preferring to go over to a cardiologist over a primary care physician. But I'm just giving you an extreme example of a situation where it can be it costs the system a lot of money, and people end up paying in higher premiums, but they don't really feel the effects when they're actually seeing the physician, and their copay is pretty low. If suppliers raise their prices 15% per year, there's no check from insurers. So if a dermatologist costs $200 today and it costs $230 tomorrow or next year, the insurance will usually just cover the amount, and because there is no check from insurers, there's really no reason, there's no price competition for a dermatologist to lower their prices. The demand for insurance does not markedly decrease when medical care prices rise, and this just kind of feeds into the things I mentioned before. When a dermatologist raises their price, people will still purchase insurance because they are looking for the lower copays and controlling their unexpected costs. Conclusion is high levels of insurance have eroded the price of competition. Now, there are a few extra things that the article wants to discuss in terms of recommendations or possibilities of what we can do for this problem. I'll go back to this slide. Actions to pursue is to do nothing. Proponents argue market failure has not been adequately demonstrated. The second thing is to regulate. Proponents argue for public sector settings of budgets, control of entry of capital through certificate of need legislation. I guess this would be more like the Canadian system, public sector setting of budgets and controlling entry of capital. And the third thing is the market-oriented strategy. Proponents argue for individuals to pay for most of their medical care services by including substantial deductibles in health insurance policies. So instead of people having a $2,000 deductible, we could have them carry a $15,000 deductible. So they have to pay out of pocket $15,000 before insurance starts to kick in, and they pay 80%. That might not affect the copays as much, or perhaps they could get rid of copays and have people pay 20%, maybe a sliding scale of that. But perhaps 20% of a $200 visit to a dermatologist, so people are feeling the effect of paying $40 versus, let's say, if they see a dermatologist that costs $300, they'd have to pay $60. So they would consider price shopping a little bit more. The authors also propose to rate hospitals and physicians based on cost effectiveness, and I thought this was kind of a good idea. You can have a CPI, in a sense, 100 being the standard index value, and if a physician was more cost effective, it could be rated, he could be rated 90, or she could be rated 90, and if they were more expensive, they could be rated 110 or 120, for instance. I want to go back to this last slide here. The increase of price and expenditures. These are some of the key points of this article. High levels of insurance causes medical care prices and expenditure to increase at above average rates independent of changes in demand. So that's kind of what I mentioned before, is that when prices increase or decrease, really doesn't have too much of an effect on purchases of insurance, and the price of physicians or healthcare providers or services or procedures like MRIs, appendectomies, when prices of those rise, it doesn't really affect the consumer demand. Insurance heavily subsidizes the marginal unit, and that just feeds back into people purchasing not based on price. Insurance premiums do not reflect choice of provider. If people choose insurance A over insurance B or C, they're typically not getting any better service, less service, more coverage or less coverage. the rate of technological change is higher than would occur without insurance. That goes into what I discussed earlier about technology. Um, there's an incentive for people to innovate and create new technology, which is a good thing actually, but it does lead to higher costs. And they might be short-term costs. Things that are patented typically cost more. And as we develop ways of the process innovation, ways of um, using technology more cheaply over time, those costs should fall. But insurance gives incentives for technological change in a good way, and in a bad way because it's costly. In a good way because we have um, we're better able to utilize these technologies when there is no treatment available today. The new technologies give us ways of treating or managing diseases in the future. The price competition among firms is diminished. Once again, dermatologists have no incentive to reduce their prices. Cardiologists have no incentive to reduce their prices in an insurance system where reimbursement is uncontrolled. Insurances are reimbursing without um, any rules or regulations to physicians saying, we won't pay any more than a certain amount for certain procedures. And so if the government, going back to the regulation aspect, here number 2 is to regulate. If we could control reimbursements, that could be a possible way of resolving the problem. And that's about it. Thank you for listening.